Good morning, Hillman Cancer Center. My name is Angela. I'm a registered dietitian for the Wellness and Integrative Oncology program here on the 3rd floor of Hillman Cancer Center. The last Wednesday of every month, we have been doing a Q&A. So we are going to start with some questions that I've received over the past month. To kick us off, the first question I received was having patients avoid fruits and vegetables when they have a low immune system or they're neutropenic. So for my oncology patients, I'm sure you're familiar with low white blood counts, being neutropenic, and having to be a little bit more mindful of your food choices, especially food safety. So to answer that question about avoiding fruits and vegetables, that is actually not true. You do not need to avoid fruits and vegetables. The best option is to just wash your fruits and vegetables very well, and making sure that you're practicing food safety overall. So avoiding raw or undercooked foods, trying to stay away from buffets and things that are higher risk for infection. In the past, we used to tell patients to avoid yogurt or something with live active cultures, but that's also no longer the case. Your best option is to ask your dietitian if there is any specific food restrictions for you specifically. But to answer that question, you do not need to avoid fruits and vegetables. Fruits and vegetables provide a number of antioxidants, phytonutrients that you want to help boost your immune function. So if anything, you want to eat more of those. So to stem off that, I had a question about consuming organic foods. So when it comes to organic foods, I personally suggest purchasing organic meat and dairy, or high quality options of meat and dairy, to eliminate the hormones, the antibiotics used in the processing of those products. So when it comes to fruits and vegetables, other sources of organic foods, it's really not necessary. Again, just making sure that they're well washed, and choosing things that are in season to give you the best quality. Now, again, I mentioned that choosing organic meats and dairy is my preference, is my personal opinion as a registered dietitian, especially in the oncology setting. So there is really no evidence or, I guess, science to back that up, but that is what I encourage my patient to do, just to spend the extra few dollars on those sources of foods, not anything else. So I got a question recently too, again, going back to organic foods, but think about it when you go through the grocery store. There's organic potato chips, there's organic pretzels. I mean, those things you do not need to spend those extra few dollars on. But like I mentioned, meat and dairy is maybe a better idea to purchase something that's a little bit higher quality. Now, the third question I'm going to address is becoming vegan or vegetarian. So I just mentioned meat and dairy, and to me, again, there's really no evidence to support this, but I believe in a well-balanced diet that every food group fits. So I don't necessarily feel that becoming vegan or vegetarian is a better option. I do encourage increasing intake of fruits and vegetables, whole grains, plant-based proteins like beans, lentils, nuts, and seeds. There is benefit to that. However, again, eliminating any sort of food group is not necessary. Now, if you are vegan or vegetarian and that's your preference, or there's some reason that you're following that specific diet, that's completely fine, and you can absolutely receive all your adequate nutrients through a diet like that, but it does require some education and knowledge. So for example, meat and dairy is our main source of vitamin B12. So if you're eliminating those food groups, you may need to supplement with vitamin B12. So just keep that in mind, and that's something that you would discuss with your dietitian, and just overall your healthcare professional team, to make sure that you're receiving adequate nutrients and not becoming deficient in anything. So those are our questions for this week. If you have any specific questions, please feel free to email me. I'm going to add my email below. Give me 1 second. So as you can see, my email is at the bottom of the screen. If you do have any specific nutrition-related questions, it does not have to be cancer or oncology specific. Please feel free to shoot me an email and that I will address it at our next Q&A. So that would be the last Wednesday of December. I'll see you then.